Hey everyone, over the years working with patients who have poor sperm health and sperm factor infertility, so either low sperm concentration, low sperm motility, or low normal sperm morphology, or elevated DNA fragmentation, which is a newer test that we've been talking a lot more about in our latest videos and research posts. So um, before, we used to believe that the urogenital tract for patients that were assigned the male gender at birth was actually a sterile environment, so no bacteria and no microbes. And what we've learned over the last few years in newer research papers that have come out is that that's actually not a complete truth. So we're seeing that there is actually the possibility of having what we call commensal bacteria. So commensal bacteria are bacterial strains or microbes that can be present on a specific surface or in an organ where they may not cause an infection but persist there as part of the normal microflora or community. So for the male reproductive organs, basically what we've seen is there's an increased likelihood of having specific strains of bacteria for patients that have healthy sperm parameters. And for patients that have unhealthy sperm parameters or infertility, we're seeing a greater chance or probability of seeing these other types of community commensal bacteria and microbes that can unfortunately may be associated with a decline in sperm fertility and health. So how do certain bacterial strains impact sperm health? So there's a few different hypotheses that are being thrown around in some of these research papers, and we're not completely sure, but we do see that certain types of microbes can increase inflammation and other types of microbes can reduce inflammation. And sperm cells are incredibly vulnerable to both inflammation and reactive oxygen species. So oxidative stress is very harmful for sperm cells. And we see that when inflammation goes up, we can actually see an increase in these reactive oxygen species as well. And these ROS, that we call them for short, can actually harm and decrease the quality and integrity of the sperm cell DNA as well. So we call it increasing genomic instability, which we've talked about quite a few times in our past research videos here, and how poor genomic stability for the sperm cells is very closely associated and correlated with increased miscarriage rates and potentially increased infertility rates as well. So it may actually make it more difficult for patients to get pregnant. So this new look at the type of bacteria or microbes present in the urogenital tract is quite exciting because it provides us with another avenue to investigate, consider, and potentially discuss therapies, especially since a lot of the treatments that focus on microbiomes have such a high safety profile, to look at if this may be what's potentially causing an issue, especially for patients that have poor sperm quality and low sperm parameters, and there's no conceivable reason on why the numbers are so low. We can't pinpoint or find any issues whatsoever, so we call it idiopathic infertility. So we're just not able to explain it. It becomes unexplained in that sense. So this is something we've been seeing over the past few months, particularly in the past year, even starting in 2019, we started looking into it more closely for specific patients. And we do see that certain patients that have mild or moderate kind of symptoms of like a low-grade infection, and in some patients who don't have any symptoms, just by treating them with an antimicrobial and giving them therapies to support the growth of healthy bacteria, certain probiotics and prebiotics, we might actually see an improvement in that sperm health as well. And it's important to mention that, the presence of these microbial communities in patients that are have high good fertility versus patients who have low fertility, it's an association and correlation. It's not a cause and effect. So we don't know if it's the bacteria that are actually causing the infertility, or if it's infertility exists, there's an issue going on in the urogenital tract, and it makes it more likely for these bacterial strains to be present. But what we do know consistently is that when we see these groups of bacteria, we can predict whether the sperm health is actually optimal or suboptimal. And so basically the main bacterial community we'd like to see in the urogenital tract for patients is a lot of lactobacillus. And lactobacillus species are very important because they produce lactic acid. So they help to regulate the pH for the sperm cells, which is something they're so sensitive to. And so it helps to protect them. It can also reduce inflammation potentially. And then we see these other groups of microbes, such as Pseudomonas or Prevotella, or we have what's called polymicrobial enriched communities. So we're seeing multiple groups of microbes. And when we shift away from this lactobacillus dominant and healthy microbiome, we start to see that sperm fertility and sperm parameters start to decline as well. So for patients that have like mild or low grade symptoms, or patients who don't have any symptoms of a underlying infection, but they have severely low sperm parameters, and there's no other identifiable reason for why that might be occurring after all the classical and indicated diagnostic workup. This is a very important discussion to have on potentially if the microbiome may be contributing to that poor sperm health, and what the approach would be to help improve that with your healthcare provider. As always, if you guys have any questions whatsoever, send us a direct message or drop us a comment here, and we'll be happy to respond.